Hi everyone, this is Dr. Akhtar again, and this is the second part of my first lecture. So in the second part, I'm going to discuss about the perineal structures. I think you may know already about the layers of the anterior abdominal wall, fascial layers. In the anterior abdomen, below the umbilicus, underneath the skin, the superficial fascia of the anterior abdominal wall has two layers: the superficial fatty layer and a deep membranous layer. The superficial fatty layer of the anterior abdominal wall below the umbilicus is also called Kemper's fascia, and the deep membranous layer is also called Scarpa's fascia. And this deep membranous layer of the superficial fascia of the anterior abdominal wall is continuous inferiorly with the superficial fascia of the scrotum and penis, and over the scrotum and penis this superficial fascia is called dartos fascia. And also this superficial fascia is continuous with the superficial fascia over the perineum. And in the perineum, the superficial fascia is called Colles fascia, fascia colles. So the Colles fascia in the perineum, in the urogenital triangle, and the dartos fascia over the penis and scrotum, and the Scarpa's fascia on the anterior abdominal wall below the umbilicus is a continuous layer. And all these are the superficial fascia. And this superficial fascia is attached with the deep fascia in this line. You can see here is a dotted line which lies in the junction of the abdomen and the thigh. And here in this line, the superficial fascia is attached with the deep fascia tightly. And also the superficial fascia, this superficial fascia is attached posteriorly in this line, which is the posterior border of the urogenital triangle. So superficial fascia is not continuous with the superficial fascia of the anal triangle. It is attached right here. So it lies over the superficial perineal space in the perineum. So underneath the superficial fascia, you can see here the superficial fascia cut and reflected. So underneath the superficial fascia, there is a narrow space which is called superficial perineal space. Superficial perineal space is bounded deeply by the perineal membrane. So in between the superficial perineal fascia and the perineal membrane, this space has different muscles. It contains muscles and erectile tissues in the male and female. And in the male and female, the structures are different. In case of male, the superficial perineal space contains three muscles, which covers the three erectile tissues. On the right hand side, you can see these are the erectile tissues. And on the left hand side, you can see the erectile tissues are covered with this muscle. We removed the muscle. The muscles are removed on the right side. So there are three muscles and three erectile tissues within the superficial space of the male. Superficial perineal space of the urogenital triangle in the male. These three muscles are named bulbospongiosus, then ischiocavernosus, and superficial transversus perineal muscle. Also on this right side, also there are another bulbospongiosus, ischiocavernosus, and superficial transversus perineal muscle. And these muscles are attached on this membrane, which is called perineal membrane. In between these three muscles, this membrane is the perineal membrane. And also these muscles covered the erectile tissues of the penis. So within the superficial perineal space, these are the erectile tissues, which are the bulb of the penis in the center. And on each side, there are two crus of the penis. The crus of the penis, you can see, is attached to the ischiopubic ramus. Ischiopubic ramus gives attachment to the crus of the penis. Also, it is covered by the ischiocavernosus muscle. So on each side, the two crus of the penis is covered by the ischiocavernosus muscle. And the bulb of the penis is covered by the bulbospongiosus muscle. The two bulbospongiosus muscle meet in the center by a median raphe. And this bulbospongiosus muscle and superficial transversus perineal muscle, and also you can see surrounding the anal canal is the external anal sphincter muscle. All these muscles are attached or inserted into a central tendinous point, which is called perineal body. Perineal body is a fibrous tissue or fibrous band which lies in the center of the perineum, and it receives the attachments of all these muscles: the bulbospongiosus, superficial transversus perineal, external anal sphincter, all these muscles attached here. So bulb of the penis and crus of the penis, these are called the root of the penis. And these bulb of the penis and crus of the penis, these are the erectile tissues of the penis. So see, the bulb of the penis, it is continuous anteriorly, and it is continuous with the corpus spongiosum penis. Corpus spongiosum penis, at the end, it is expanded and it forms the glans of the penis. And the two crus of the penis, already I mentioned that it is attached to the ischiopubic ramus, and these crus of the two crus of the penis, these are continuous with the two corpus cavernosum penis. And corpus cavernosum penis covers the corpus spongiosum penis. And if we make a cross section right here, you can see the cross section right here. So the two corpus cavernosum, which forms the dorsal side of the penis, and the corpus spongiosum penis, which forms the ventral side of the penis. This is the ventral side of the penis. And corpus spongiosum penis contains the spongious urethra. The urethra is passing through the corpus spongiosum penis. So the bulb of the penis and crus of the penis, these are the root of the penis, and this is the pendulous portion of the penis, which has the two corpus cavernosum and corpus spongiosum penis. And in the cross section, you can also see underneath the skin, the penis is covered by the superficial fascia. So you know that the superficial fascia of the penis is called dartos fascia, which is continuous with the scarpus fascia and the colles fascia. And superficial fascia of the penis contains dorsally a superficial dorsal vein. Underneath the superficial fascia, this is the deep fascia of the penis. The deep fascia of the penis is called Bach's fascia. And deep fascia covers the corpus spongiosum, and also it surrounds the corpus cavernosum. And underneath the deep fascia, on the dorsal side, you can see there are veins, arteries, and nerve. In the center, there is one deep dorsal vein, and on each side of the deep dorsal vein, there are two dorsal arteries, and on each side of the two dorsal arteries, there are the dorsal nerve of the penis. Excuse me. The two corpora cavernosum and the corpus spongiosum is enclosed by tunica albuginea. So tunica albuginea is this. And already I mentioned that corpus spongiosum contains the spongious part of the urethra. Male urethra is very long. So urethra begins in the urinary bladder. So see, in this picture you can see the urinary bladder, which lies behind the pubis. This is a mid-sagittal section. And underneath the urinary bladder, the urethra begins in the internal urethral orifice. And then the male urethra, it passes through the prostate, which is a gland surrounding the neck of the urinary bladder. And then the urethra passes through the perineal membrane. And that part of the urethra which passes through the perineal membrane is called membranous part of the urethra, or the intermediate part of the urethra. And the spongious part of the urethra is within the corpus spongiosum. Here this is the root of the penis, and here is the corpus spongiosum penis. So urethra goes all the way through the corpus spongiosum penis and within the glans penis, and here is the external urethral orifice. So external urethral orifice is at the tip of the glans penis, and internal urethral orifice is within the urinary bladder. So this is the cadaveric image. You can see internal urethral orifice or opening is right here, and here is the prostatic part of the urethra, then the intermediate part or the membranous part of the urethra, and you can see this is the bulb of the penis. So the urethra passes through the bulb of the penis and then through the corpus spongiosum of the penis, and here within the glans penis, this is the external urethral orifice, and these are the corpus cavernosum penis, which forms the dorsal side of the penis. So, and the spongious part of the urethra, it is very superficial, and if there is any injury to the spongious part of the urethra right here, there is extravasation of urine or blood, and if there urine or extravasation of the blood, these will accumulate under the superficial fascia of the scrotum and penis, that is the dartos fascia, and you can see it can accumulate over the penis right here, and it can also accumulate in the superficial perineal space because the fascia collis is also continuous with the dartos fascia. And also this extravasation of blood, it can go above into the anterior abdominal wall because the scarpus fascia is also continuous with the dartos fascia. So this extravasation of the blood or urine can accumulate under this scarpus fascia, dartos fascia, or the collis fascia, but it cannot go into the thigh because in the junction of the thigh and anterior abdominal wall, it is attached with the deep fascia. So here in this illustration, you can see this is the internal urethral orifice, which is surrounded by the internal urethral sphincter muscle, which is a smooth muscle. And then this part of the urethra, it goes through the prostate, which is an endocrine gland, which is a gland, male reproductive gland, which secretes prostatic fluid. And then this part of the male urethra is called intermediate part or membranous part of the urethra. And then within the corpus spongiosum, this is the spongious part of the urethra. So urethra begins in the internal urethral orifice, and then it goes all the way through this corpus spongiosum penis, and within the glans penis, it has a dilated part. And this dilated part of the spongious urethra within the glans penis is called navicular fossa. And this is the external urethral orifice or external urethral meatus. External urethral meatus is the narrowest part of the male urethra. And the external urethral meatus is at the tip of the glans penis, and sometimes there may be congenital defect. External urethral orifice may be on the ventral side of the penis, and that is called hypospadias. And this is a common defect. And in the deep perineal space, deep to the perineal membrane, the intermediate part or the membranous part of the urethra, you can see it is surrounded by a muscle that is called external urethral sphincter muscle. External urethral sphincter muscle surrounding the membranous part of the urethra in the male, and internal urethral sphincter muscle surrounding the internal urethral orifice within the bladder. An internal urethral sphincter is formed by smooth muscle, and that is controlled by autonomic nervous system, not under voluntary control. The external urethral sphincter muscle is a skeletal muscle, and it is controlled by the somatic nerve, and this muscle, when this muscle contracts, it stops the flow of the urine, and this muscle is under voluntary control. So this muscle controls and it can stop the flow of the urine. So underneath the pubis, the scrotum is a fibromuscular cutaneous sac. The scrotum is a fibromuscular cutaneous sac which contains the testis and epididymis. And the scrotum is continuous superiorly with the spermatic cord. And the scrotum, there are different layers or coverings of the scrotum. So underneath the skin there is superficial fascia, and already I mentioned that the superficial fascia is called dartos fascia. And within the scrotum, the dartos fascia has a smooth muscle, and that smooth muscle is also called dartos muscle. And due to this, the presence of this smooth muscle or dartos muscle within the superficial fascia of the scrotal, underneath the scrotal skin, the skin of the scrotum has a wrinkled appearance. So skin, then dartos fascia, and then it has the external spermatic fascia. External spermatic fascia is continuous over the spermatic cord also, and this fascia is continuous, or it is coming down from the external oblique muscle. So from the external oblique muscle, the external spermatic fascia, which covers the spermatic cord, and also it encloses the testis and epididymis. So external spermatic fascia. And then the cremasteric muscle and cremaster muscle and cremasteric fascia. Cremaster muscle and the cremaster fascia, it comes or it continuous with the internal oblique muscle of the anteroabdominal wall. And then the internal spermatic fascia. Internal spermatic fascia is coming from transversalis fascia. Fascia transversalis, which lies underneath the transversus abdominis muscle in the anteroabdominal wall. So external spermatic fascia is coming from external oblique muscle, cremaster fascia from the internal oblique, and the internal spermatic fascia from the transversalis fascia. And then the peritoneum. Peritoneum is also continuous underneath this fascial layer, and the peritoneum, it forms this parietal and the visceral layer of the tunica vaginalis. We call it tunica vaginalis, but this is derived from the abdominal peritoneum. So parietal layer of the tunica vaginalis, it is the most inner layer. It is the most inner layer of the scrotum and the spermatic cord. And the visceral layer of the tunica vaginalis is the shiny membrane over the capsule of the testis. So you can see visceral layer on the testis and epididymis, and parietal layer on the inner side of the scrotum. The testis and epididymis, they lie within this scrotum, and here is the spermatic cord by which the testis is suspended within the scrotum. So here you can see this is the parietal layer of the tunica vaginalis, and here is the visceral layer of the tunica vaginalis, and underneath the visceral layer of the tunica vaginalis, the testis has a thick whitish capsule. The thick white capsule of the testis is called tunica albuginea. The tunica albuginea or capsule of the testis, it sends septum. It sends septum within the testis, and this septum divides the testis inside of the testis into lobules. See, there are lobules, and in between the lobules, these are the septum. Within the lobules of the testis, there are fine thread-like structures, which we call the seminiferous tubule. The seminiferous tubule, inside the seminiferous tubule, the spermatozoa produces within the seminiferous tubule. These are microscopic structures. So, testis is the genital organ, and testis is a gland. It secretes the sperm, it produces the sperm, and also it produces the male sex hormone, the testosterone. And sperm is forming or producing within these seminiferous tubules. And then from these seminiferous tubules, it goes through these tubules, this collection of tubules within the posterior inferior part of the testis, that is called retitestis. And from these 3 testes, there are some duct, which we call efferent ductules, which connects with the head of the epididymis. And from this seminiferous tubule, retitestis, then efferent ductules, the sperm goes into the head of the epididymis, then the body of the epididymis, then the tail of the epididymis. So epididymis is an elongated organ. See, it lies on the posterior inferior aspect of the posterior position of the testis, and then it has head, body, and tail, and the tail of the epididymis is continuous as ductus deferens. So ductus deferens is the continuation of the tail of the epididymis that carries the sperm from the epididymis, and it goes all the way. It is going through the spermatic cord, and it enters into the pelvic cavity through the deep inguinal, superficial inguinal ring, deep inguinal ring, and then it goes to the behind the urinary bladder into the prostatic part of the urethra, and it carries the sperm all the way from the testis into the prostatic part of the urethra. So this is testis and epididymis. And spermatic cord, it extends from the superficial inguinal ring. It extends from the superficial inguinal ring up to the testis, or you can see here, it extends from the testis to the superficial inguinal ring right there. So, and if we make a cross section through the spermatic cord, what are the layers of the spermatic cord? The same layers like the scrotum, the skin, external spermatic fascia, the cremaster muscle and the cremasteric fascia, and the internal spermatic fascia. And then the spermatic cord contains the ductus deferens. Ductus deferens or vas deferens, it is a muscular tube that carries sperm from the epididymis to the prostatic part of the urethra. And also it has the testicular artery. Testicular artery is a branch of the abdominal aorta. It is also exiting through the deep inguinal ring and superficial inguinal ring, and is going to supply the testis. And testicular artery is surrounded by a venous plexus, which is called the pampiniform plexus of vein. Pampiniform plexus of vein surrounding the testicular artery, it helps in the it acts like a countercurrent heat exchange mechanism, and it lowers the temperature of the testis or arterial blood. The pampiniform plexus of vein is passing through the spermatic cord, but when the spermatic cord ends at the superficial inguinal ring, the ductus deferens, when it enters through the deep inguinal ring, the testicular vein when the deep inguinal ring, the pampiniform plexus enters through the deep inguinal ring and superficial inguinal ring, it forms a single vein, which we call the testicular vein. And testicular vein, already you have seen in the posterior abdominal wall, the single testicular vein that on the right side it drains into the inferior vena cava, and on the left side it drains into the left renal vein. So the male urogenital triangle, it contains the muscles. It contains the muscles bulbus spongiosus, ischio cavernosus, and superficial transversus perineal muscle. It contains erectile tissues. Also, it contains the blood vessels and nerves. The blood vessels, already I mentioned that the internal pudendal artery, it gives rise the inferior rectal arteries. Inferior rectal arteries supply the external anal sphincter muscle, and this lies in the anal triangle in the ischioanal fossa. Internal pudendal artery also gives rise perineal arteries. There are some perineal arteries, and which give rise the posterior scrotal branches, supply the posterior side of the scrotum, and also there are deep artery of the penis, which courses through the corpus cavernosum penis, and the dorsal artery of the penis, which passes over the dorsum of the penis. Those are also branches of the internal pudendal artery. So in this illustration, you can see the internal pudendal artery and the pudendal nerve. They lies within the pudendal canal. Within the pudendal canal in the anal triangle, and within the pudendal canal, it gives rise the inferior rectal nerve and inferior rectal vessels, which supply the external anal sphincter muscle. See the anal canal surrounding by the external anal sphincter muscle. And then the internal pudendal artery and the pudendal nerve both give rise the perineal branches. Perineal branches of the pudendal nerve. It has superficial perineal branch and the deep perineal branch. The superficial perineal branch give rise posterior scrotal nerve, which supply the posterior side of the skin over the scrotum. And the deep perineal branch supply the muscles within the superficial perineal space, the bulbospongiosus, ischiocavernosus, all this muscle. And then the pudendal nerve and the internal pudendal artery, it also courses more anteriorly into the urogenital triangle. And the internal pudendal artery, it gives rise the dorsal artery of the penis and the deep artery of the penis. And the pudendal nerve, it gives rise the dorsal nerve of the penis. So see, on the dorsal side of the penis, I already mentioned that there is a deep dorsal vein, and on each side there are two dorsal arteries, and then there are two dorsal nerves. The dorsal arteries are the terminal branches of the internal pudendal artery, and dorsal nerve of the penis are the terminal branches of the pudendal nerve. This deep dorsal vein of the penis, you can see here, is draining under the pubis, and it enters into the pelvic cavity and it drains into the prostatic venous plexus. So deep dorsal vein is draining into the prostatic venous plexus. This is clinically important. The female external genital organs, it is called vulva. It lies within the female perineum into the urogenital triangle. And female external genital organ, it includes the mons pubis, which overlies over the pubis. And there are two folds of skin on each side, the labium majus. Labium majus is homologous with the scrotum of the male. The mons pubis and the labium majus is covered by the hair, pubic hair. And inside the two labium majus, there are two labia minus. These are the folds of skin, but these are hairless. The two labia minus, they join together and they form a covering or hood over the glans of the clitoris. Clitoris is the erectile tissue in case of female, and clitoris is homologous with the penis of the male. And like the penis of the male, the clitoris in the female, it also has a crus, it also has body, it also has glands. But this body, crus and glands of the clitoris is much smaller. These are much smaller than the crus, body and glands of the penis. And these glands of the clitoris is covered by this hood. This is called prepuce of the clitoris, like the prepuce of the penis, which is the foreskin over the glands of the penis. So, and in between the two labia minus, this space is called the vestibule of the vagina. This is the vestibule of the vagina, which has two openings, which has two orifices or two openings. This is the vaginal orifice, and here there is another small orifice superiorly. This is the external urethral orifice. So in the female urogenital triangle, there are two openings, external urethral orifice and the vaginal orifice. And within the superficial perineal space of the female, like the male, there are three muscles, the bulbospongiosus, ischiocavernosus, and the superficial transversus perineal muscle. But these muscles are very small, much smaller than the male. And these muscles are very difficult to see in the cadaveric dissection. And underneath this muscle, there are some erectile tissues, not that important in the female. These are the bulb of the vestibule, and also like the crus of the penis, the crus of the clitoris, and the body of the clitoris. These are the erectile tissues of the, in case of female, within the superficial perineal pouch. But the important thing is that deep to the superficial perineal space, like the male, it is bounded deeply by the perineal membrane. And deep to the perineal membrane is the deep perineal space. And you can see here, this is the perineal body. The perineal body, like the males, it receives the insertion of all these muscles in the superficial perineal space, and also the external urethral sphincter muscle is attached to the perineal body. In case of female, the perineal body is situated in between the vaginal orifice and the external anal orifice. And this perineal body is important in case of female. It gives support to the pelvic organ, especially the uterus. In case of female, the perineal body is one of the major support for the uterus. And you can see here, this is the perineal membrane. And on this side, on the right hand side, you can see the perineal membrane is removed, and you can see the female urethra deep to the perineal membrane is surrounded by external urethral sphincter muscle. And like the male, the external urethral sphincter muscle is a skeletal muscle. It is under voluntary control, and it is supplied by the pudendal nerve, and which is a somatic nerve. And in case of female, the female urethra is very short, and it is approximately 4 centimeter long, and most of the female urethra is surrounded by the external urethral sphincter muscle. So, and in the female, like the male, already I mentioned that the pudendal nerve, it gives rise the superficial perineal and the deep perineal branches. The superficial perineal branch, it gives rise posterior scrotal branch in case of male, and in the female, it gives rise posterior labial branch, which supply the posterior part of the labium majus. And the deep perineal branch, like the male, it supplies the muscles which lies within the superficial perineal space. And in the urogenital triangle, these are the perineal branches, and in the anal triangle, you can see the inferior rectal nerves. Inferior rectal nerves in both male and female, it supplies the external anal sphincter muscle. So pudendal nerve is the major nerve for the anal triangle and the urogenital triangle. Both all these structures get the nerve supply from the pudendal nerve. That's all. Thanks for your attention.